I mean, it's kind of crazy. Oh, also, I wanted to just remark, yeah, absolutely, you're right. Like, we shouldn't be scared. We should be, as another doctor, Dr. Mike on YouTube says, we should be alert but not anxious. Like, fear doesn't help here. It just will tire you out. Yeah, I think that's part of the reason people are sick, say they're sick of seeing it on the news, is because they get a little anxious every time they see it. But then, like, stress over time, obviously, that's tiring. And I understand that. Yeah. But, you know, it shouldn't cause fear. It's just, it is alarming, but logically alarming. Also, isn't it crazy, though, if you had shown me this in December, if you had shown me the title, the news from today, even, in December, I would not have believed you. I would not have believed you.
Definitely.
Like the WHO, I believe, declared this very high risk for, like, as the status of the virus. I mean,
still not a pandemic, though.
I would
very high risk of global spread.
True.
Still not a pandemic, though, according to the WHO. But definitely, it's crazy what's been happening in 2020 right now.
It's very apocalyptic vibes.
Oh, definitely. We're really getting a real kind of reality check right now, because a month ago I would not have believed you. Obviously, you get an initial scare when you first hear about a new virus. Oh boy, like the SARS virus, like Ebola, things like that, and you're like, well, in the back of my mind, I'm always like, well, listen, it's not really gonna reach here. First of all, because, you know, it never really, you know, in the past, we get 1-2 cases, like, you know, the Ebola virus. It was obviously a big scare. And I was young, so I didn't really care. But, you know, for other people.
Same.
But it was never an actual thing that you had to, like, live through, you know? Yeah. So you're looking at it at a distance. You're like, oh, China, oh, new cases in China, new cases in Japan, new cases in Hong Kong. But now, especially when I got home from skiing last week and we turned on the TV, and I had no idea it was going on in Italy. Because not from Italy at all, because I just, for the past couple of, like, days, you know, signal at my cottage is, you know, you can imagine. So I came back, turn on the radio, the TV, and they say, yes, and now Italy reporting over 100 cases. If you saw my face, my jaw dropped, and that was the moment of realization where I was like, oh, this is probably going to be a bit more than,
Yeah, like, this is getting real. That was my reaction. Yeah, I mean, the fact that it can spread in Italy like that is alarming, because I don't know that our country's healthcare is better than in Italy. And, like, our, what do they call it? I think they call it epidemic plan, something like that. You know, preparation for an epidemic. I don't think it's much better than they have in Italy. But, you know.
Yeah, thinking,
I guess we'll have to see.
We'll have to wait and see. We'll, only when it comes, we will see. That's exactly why spreading, or at least slowing down the spread of the virus, is so important. Because if not, our healthcare don't really, because so many beds right now are, you know, occupied by people who have the normal flu, who have the influenza virus. You know, what's scary, what's, you know, a little concerning is that if it does spread real fast here, and you might think, okay, well, but Italy only has 1,000 cases. Yes, but 10-15% of those cases are critical cases. Let me check. Oh, right. 105 of these cases are critical, which might not sound like a lot, but 105 of these people have to be in hospital and have to get a lot of supportive care, you know, who have pneumonia. Yeah. And that is a little scary, considering that, yes, China obviously is very densely populated, but they do have the number 2 biggest, you know, GDP. And they were struggling to contain it. Now, of course, that they have implemented very great measures, I must say. China has been... What do you think about China and its containment effort?
Oh, yeah. I mean, I think they have definitely put in good effort. Except, I mean, excluding the initial suppression stage where they try to pretend like nothing was going on.
Yeah.
Absolutely excluding that. They have been doing a good job in trying to, contain the spread of the virus.
Mm-hmm.
But I do want to say that this is a unique case because of the way that China's government is, because of the way that it's structured. I don't think anything quite like that could happen here, where they just shut down, quarantine a city in, a matter of, I think it was over a day or so.
Crazy.
I'm not sure.
I think the population in China are, very disciplined, the people there. And it all comes down to how willing, is a person to trust the government, And so China putting these measures, being like, okay, you can't leave, especially like in Wuhan, the hotspots being Beijing, you can't leave, only, once in 3 days can a person go and buy food, groceries, only convenience stores are open. If you get signs of the virus, you can either go to a quarantine zone or you self-quarantine, and we're going to put up tape on the door, and if the tape is ripped, we're going to drag you to the quarantine zones. Okay, that's not, I'm just not going to drag you, but you're going to have to go to these quarantine zones or whatever they're called. So the measures are strict. I have a friend in, she lives in Shenzhen, so it's obviously a bit further away from the hotspot, and she, was discouraged from going outside. She stayed inside most of the time. She wore a mask all the time, and yeah, it's just these very strict measures. I feel like not every single country, especially, some much more democratic countries, I'm not sure if everyone is really willing to kind of follow the government's orders as much as obviously China.
Yeah, even in Tenerife, in the hotel that's quarantined, people were seen breaking the quarantine rules and just walking around. Just goes to show people don't respond the same way everywhere. Mm-hmm. Yeah.
This is a bit of a change in topic, but this also is more about kind of how much do you actually willingly want to care about this situation, is getting tested, I read somewhere that 2 out of 3 people don't go and get tested who might be infected. And also I didn't search this, so I'm sorry if this is wrong, but apparently it costs money to be tested in countries like the United States or Italy as well, or is it
in here as well, did you say?
In Italy, if it costs money to be tested for the virus.
Oof, I'm not sure about Italy, but I do know that here, unless you're showing like symptoms, unless you're like loudly coughing and like having a headache and showing all the symptoms, or not all, but showing symptoms of the coronavirus, and even if you've just come from Italy, just as the outbreak happened, even if you've come from there but you're not showing any symptoms, potentially because you're in the incubation phase, you won't they won't test you for free unless you're showing the symptoms, which is alarming because the test is not cheap. Like, this isn't something that the average working person here can just dish out. And like, especially for just the concept of general public safety, it's I don't think it's well handled.
Yeah, definitely, and it is concerning knowing that, just considering how many people, like we talked about before, just large amounts of people in Italy came back from Italy, and no one really is being tested here, and same thing in the United States. No one was really tested, and now they're starting to see these cases in the United States and California where people are being tested positive for the virus but have no ties to, they haven't gone outside of the country, they haven't come into contact with anyone who has gone outside of the country, and haven't come into contact who shows symptoms, which kind of suggests that there's now community spread, which is obviously alarming, because I must laugh at Donald Trump, as always. No, sorry about that, but just the remarks, and he put his Vice President Mike Pence in charge of the coronavirus effort, which is something interesting because Pence has a record of, he was a governor of Indiana, and his response to an HIV outbreak there was to veto a medically recommended needle exchange program to offer his prayers instead. So clearly they have a and then of course Trump mentioning that in a couple of we're not going to have any cases, maybe just 5 cases. It's very good, we're prepared, very well controlled. So just
I love the little impression you did. But yeah, I mean, that thing about Mike Pence, though, super interesting. I didn't even know that. Yeah, that's also alarming, not just interesting.
Yeah.
Yeah, and I mean, I read somewhere that the first sign of community spread that's when you should be alarmed a little bit, and that's when you should, start taking precautions when you go outside. I mean, ideally even before then, but just if you feel that you need to protect yourself, you should buy a respirator. If you're sick, a face mask is effective, but if you're not sick, then it's limited. A respirator is better. If you're in America, that would be the N95 rating, and if you're in Europe, that rating is FFP3. So not 2 or not 1, but FFP3. That is supposed to partially filter out viruses, but again, it's unknown, right? We're not entirely sure how effective it is.
Actually, talking point here is how effective are actually masks, because obviously a lot of people either think that buying a mask, a simple medical mask, is either going to protect you from the virus 100% or is 100% ineffective. And I think that because this is a novel coronavirus, it's new, we obviously don't really know everything about it, but it's always great to, at least if you have come back from Italy or a hotspot and you are concerned, maybe you're showing symptoms, it would be in the best interest of other people as well to protect them, to wear at least minimum a medical mask. And I know medical masks, there has been a debate of, well, is it really effective? No, not really, but especially when you sneeze, it prevents the droplets. It reminds you to not really touch your face. Of course, when you kind of have the mask on, you're like, oh, okay, you shouldn't touch my eyes, mouth, nose. But of course, it's a question of just how effective these can be. But yeah.
Yeah. I mean, the main ways that this virus is spread so far seems to be either through air or touching surfaces that have been touched by an infected person. And obviously it can probably spread through bodily fluids and the like as well, but the main are the two that I just said. So really just if you are outside on public transport, at school, wherever there's large amounts of people, don't touch your face, but especially don't touch your eyes, your nose, or your mouth. Respirators are important. Before you eat anything, before you put anything in your mouth, make sure to ideally wash your hands using proper technique, but also if you just for some reason can't, a hand disinfectant, I believe it's called, that if it contains, I think it was over 70% alcohol, but do make sure to check it, then it should be effective in killing viruses. But of course, again, there are some unknowns, so just being careful is, if you do the maximum you can for your health, as we just said here, that should protect you.